The following segment is sponsored by Radiation Oncology Care at Meridian Park.
In our first Health Cares with Dr. Chong, we learn about the link between good health and patient empowerment. We're happy to welcome to AM Northwest from Radiation Oncology Care at Meridian Park, Dr. Lansford Chong. Good to have you with us, Doctor.
My pleasure.
So let's talk about this. You have a certain philosophy about the relationship between patients and their doctor, right?
Absolutely.
Tell me about it.
I describe it as going forward to the past. As we go forward with medicine, we have a lot of technologies and whatnot, but I think we need to go back to the past, to the very sacred doctor-patient relationship. I think that that can be very healing and very empowering for the patients.
So a good relationship with their doctor, you believe, will help them heal faster?
Absolutely, and it will help them participate in their care, follow their directions better, and
they'll listen to what the doctor says.
Absolutely.
Is what you're saying. That makes sense.
Instead of fighting one another
Right.
or whatnot. You need to have trust and confidence in your doctor, and I think that it's a mind, body, spirit approach that I have. You're just not dealing with cells and chemicals. You're dealing with someone who has a spirit, an emotion, and all of that needs to be addressed as a physician in terms of being a healer.
You mentioned to me before we started the show that your grandmother, you remember going with your grandmother to, she got radiation treatments when she was dealing with her cancer. Do you think that maybe gave you this kind of approach to it, that you saw how she was treated, what you saw, how it affected her?
Absolutely. She was a person who couldn't speak much English and easily could have been brushed aside,
Right.
Just treat her, don't talk to her and whatnot. But she also had a lot of fears, and the people really took their time and
handled her really well.
Absolutely.
Yeah, how do we find a good doctor? How do you, normally it's just we go to whoever our insurance tells us to go to, but how do you think we should look for a doctor? Do we have a phone conversation with them first?
You know, I think that one should do one's research. You can go on the internet, you can speak with relatives, friends, and then look up the doctor. Look at their credentials, and sometimes it's important to even go for another opinion with that physician. And if that relationship isn't there, you have the power to make a change, because I think that this relationship is one of the most important ones in one's life.
What is a sign of a good doctor to you? Someone who listens to his or her patient?
Absolutely. For me, I would want someone with excellent credentials and training and experience.
Right.
And
a good bedside manner, right?
That's so important.
Yeah.
Both are important. And there's so many physicians. You can find the person who has both.
Right, absolutely.
You can have your cake and eat it too.
Absolutely, why not? And you know, when someone is dealing with cancer, especially when it comes to talking about dealing with a doctor, they're stressed out, and so
Yes.
they want someone who will calm them down and make them feel like they're going to be okay. Am I right?
Absolutely. I tell my patients I don't treat them, I care for them. There's a big difference between treating a patient and caring for them.
Absolutely. Well, there's a lot more to talk to you about. So coming up next, Dr. Chong shares the most important life lessons he's learned as a physician and how they can help you too. Stick around. We're back now with Dr. Lance Chong from Radiation Oncology Care at Meridian Park. He's here to share important life lessons he's learned over the years as a clinical oncologist. So let me talk to you first about the fact that one of the things you say is that we are masters of our own lives, and you have a story to relate about that.
Absolutely. I think that this empowers an individual. There are choices that one can make with regards to lifestyle, with regards to choosing happiness versus negativity. And these are impressions I've got from my patients. One patient I had was doing very, very well, saw her for follow-up. I walk in and I said, "How are you doing, Mrs. So-and-so?" And she said, "Oh, you don't want to know." After seeing her and examining her, she was clear of her cancer, but yet her approach to life was so negative. Even though she was seemingly cured of her cancer there, how could she embrace the joy of life, the freeing that could bring her
Right.
when her whole perception on life was so negative?
Right.
So one is truly the master of one's life.
There was one patient apparently that told you to slow down.
Absolutely. I was at Memorial Sloan Kettering on the senior staff, and my clinic was on this floor where we had inpatients waiting for treatment in the wheelchairs, and I was rushing around, stressed out, and I remember this man said, "Hey, doc, you better slow down, otherwise you're going to end up with the rest of us."
Right.
And it was so true, so true.
Yeah, because you were working too hard. You needed to take care of yourself as well.
That's right. I was outside of that zone of embracing my life, promoting health in my life.
Yeah, and you weren't listening to your own message.
I wasn't.
Yeah. You also talk about cherishing and appreciating life, and you have a story of another man. Oh, that's the garbage man you were saying.
Yes,
The
yes.
sanitation worker that was telling you to slow down.
He told me that he had worked all of his life, and he and his wife said, "When you retire, we'll go and take some trips." He said, "We really didn't go anywhere before that."
Right.
He said, "Last year I retired. Look at me now. I was diagnosed with lung cancer."
Right. So he should have taken the trips earlier. Is that what you're saying? Is to
Exactly.
cherish the moment?
The moment,
Right.
and that moment is now.
And Alzheimer's patients have got to be dealing with a lot of difficult issues.
Yes.
And that's another reason you say that happiness is a part of your health.
Yes, you know, the happiness factor does affect your health. Not only quality of life, but also I believe it can affect how healthy we are in terms of being absent of disease as well. When you look at some of these Alzheimer's patients, their mental capacities deteriorate. But if they were healthy in other respects, then why can that affect them and they pass away?
Right. How does that work with Alzheimer's patients? While their mind is affected, really their body shouldn't be.
Right.
Right.
But their connection is one and the same as a very complex individual human being. And there is an effect between your mind and your body.
What did reconnecting with your dad, your mom and dad divorced, and when
Yes.
you finally reconnected with him, what did that mean for you?
It was a freeing moment for me.
Because you were telling me that
Yes.
you ended up connecting with him and he had been diagnosed with cancer.
That's
ironically.
right. I picked up the phone one day and said, you know, I want my life to work for me, not being right, but having my life work for me.
Right.
And so I traced him down and found out that he was retired. And then the end result was they put him on the phone, and his voice sounded so old because he was going through radiation therapy for head and neck cancer. And it touched his life, touched my life. He did not know that he had a grandson. He did not know that I was a physician. And when I said, you know, I wish you were at my high school graduation, he said, son, I just was in the background.
Wow. That's powerful.
Yes.
We want to tell folks if they'd like to find out more, contact Health Cares. Dr. Chong, thank you very much. I appreciate this.
My pleasure.